Hello, this is Dr. Roger Elmer, Advanced Neurospinal Solutions, and wanted to spend a little time today talking a little bit about the difference. I know these therapy guns, you've seen them, they're very, very popular, and that patients ask me about them all the time. And so I'd like to talk about the therapy gun, some of the basics relating to it, but also its relationship to the PTLMS. The PTLMS was originally designed by Dr. Burl Pettibon, and it's an on-off loader, and it goes at 3.3 cycles per second. In fact, all the other designs of the therapy guns, no matter who did it, it's a knockoff of this. And the design of the PTLMS was that 3.3 cycles per second and an on-off loader would sedate the nervous system, would cause the muscle spasms to relax, and also allow you to clear out all the sludge and toxins and that, particularly around the paraspinal area, but around the spine, but also in any other area that you need it. I call it the ultimate muscle relaxer. It sedates. Sad thing is they're not making them anymore. So if you can find one on the internet, I recommend you grab it because they've gone away. The therapy gun is actually the opposite. Turn it off, turn it on. Now, is that necessarily a bad thing? Well, it's bad if you don't know how to use it. When somebody has a shoulder pain with a therapy gun, they're putting it on the shoulder pain. Over time, that's actually going to make things worse. We're going to be talking about stretching also here, in another video. But stretching actually makes the muscle and particularly the nervous system that guards and protects that muscle to ramp up and to get worse, causing the muscle to tighten down. And it feels good while you're doing it. Well, same thing here. This will feel good while you're doing it, but it's actually cranking up the nervous system and causing it to become worse over time. It's changing what we call the muscle spindle fibers. They're getting tighter and therefore they're getting more sensitive, which is causing the muscles around those sensors to actually get more sensitive. So the way you would use this, if I were using a PTLMS and I had pain right here, I would go directly on it. That's going to turn it off. And as it turns it off, I'm going to feel better now, but also as I apply it over time, it's going to get more and more relaxed because it's causing those muscle spindle fibers to dial back and to be less sensitive, which causes the muscles to become less sensitive. Up in the spinal cord, you've got this system that has flexors versus extensors and then cross-extensor reflexors. But if I contract my bicep, I inhibit the tricep. And so if I lighten up that bicep, if it's fairly tight, and I lighten it up, then the tricep can dial up and they can become more balanced. Well, with this, we're going to do the opposite. So instead of applying it directly on the area of pain, we're going to do it on the opposite side, right? Bicep versus tricep, front versus back. So I would be putting it here in the back rather than in the front, and do that for a while and then feel how it feels. There's also what we call a right versus left system, to where when I'm walking, if this turns on, this turns off, but if this turns on, this turns off. So I can also try it here on this side to turn this on. Neurologically, it turns the gate reflex, turns it off. And then I have what's called a cross-cord reflex, which works diagonally, and so I can also try back here. The way we do it in our office, if I'm using this, I'm using it to turn it up, and I can ask the patient, okay, it hurts here, I'll do it here, feel that, move it around, do this, feel that, move it around, do this, feel that, move it around. Which one feels the best? Because it may be that we're dealing with different kinds of reflexes here. We may be dealing with a flexor versus extensor reflex, or a gate reflex, or a cross cord reflex, which is a part of the gate system. So that's how you use it. You use it opposite. If I get a spasm in the calf, I'm going to get the muscle that's in front, called the anterior compartment muscle or the anterior tibialis. So we're gonna be doing that, and we'll be getting more and more specific on how to use this in a very advanced way, so that this tool is a real tool in your hands rather than just some gimmick that you're throwing at it. Hope that was helpful. Hope it makes some sense of it. We are the why people, the why guys here in Advanced Neurospinal Solutions. We'll be doing a lot more videos that will be applying different technologies and therapies and understandings to make things a little more clear. So let us know if we can be of help. Call if you'd like to schedule an appointment with us. Let us know when you're ready to take your life back. Thank you.